people knew better to get the tissues tested. And that's when they started finding out in the autopsies of those who had passed, who were vaccinated, that the spike protein did not stay in the inoculation site. It started to spread throughout their body. And that's how they found in those autopsies where those spike proteins were going. And we're talking, it crosses over into the reproductive organs, blood-brain barrier, all major organs. And this is where it was going when we were all told in the healthcare sector that once you're injected, it just stays where you injected it. False all day. And so some people did have the money and the means to get those autopsies into their family and can prove that the spike protein was all over. And we did see a higher death in males, especially related to cardiac issues. And obviously being a cardiac nurse and in the job that I'm in now, I run an entire program with multiple hospitals for everyone that comes in with chest pain or a heart attack. And I will say without a doubt, 95% plus of the ones that come through my program have anywhere from 2 to 10 COVID-19 vaccines.
Hey, what's going on, dudes and dudettes? This is Drewski from Cryptid Warfare and Conspiracies Podcast, and you're listening to Kevin on Where the Weird Ones Are.
What's up, you fucking weirdos? Welcome to Where the Weird Ones Are.
Yeah. Weird ones only, we talking that truth. Ghost in the attic, yeah, show me the proof. Aliens creeping, they light in the roof. Minds wide open, we shatter the booth. Conspiracies deep, we dig in the scars. Demons and angels and bodies on Mars. Cryptids be watching, they lurk in the dark. Mental on edge, but we glowing like stars. Welcome to the pod, no cap, it's a seance. Whispers in the static, spirits doing dance. Reptiles in suits, yeah, running the lands. MK Ultra made a puppet of your mans. When they go hunger, dogman strut, flat woods, eyes glow. Slice through the cut, Bigfoot tagging trees. Marking the trail, weird ones ride, no room for the frail. Talking about trauma, talking that soul. Peeling back layers, we digging a hole. Sacred geometry, numbers align. Ancestors speak through the veil in the sign. Ayahuasca dreams, third eye lit. Shadow self lurking, we making it spit. No mainstream lies. This the dirt where the weird ones rise from the blood and the hurt. Weird ones only, we talking that truth. Ghosts in the attic, yeah, show me the proof. Aliens creeping, they light in the roof. Minds wide open, we shatter the booth. Conspiracies deep, we dig in the scars. Demons and angels and bodies on Mars. Cryptids be watching, they lurk in the dark. Mental on edge, but we glowing like stars. Voices in the woods got chills on the neck. Black-eyed kids at the door, now we check. CIA tapped in, fluoride drip. Project Bluebeam, watch that script. Talking about grief, talking about fear. Talking about why them voices appear. Healing the mind while breaking the chain. Spiritual warfare deep in the brain. We don't run from the strange, we live in the strange. Tattoo the truth in the scars and the pain. Stay weird, the mantra we own in the name. Reality bent, so we bend to the same. From the attic to the swamp, we tracking the freak. Where the veil get thin and the silence speak. We ain't your norm, we off that grid. Weird as the wave, yo, this where we live.
What's up, you fucking weirdos? Welcome to another episode of Where the Weird Ones Are. My name is Kevin, but you probably already knew that, and if you did not, now you do. Today's episode is with an amazing person. Her personality is amazing. She is amazing. She's beautiful inside and out, and I really enjoyed this conversation. I really love conversations that have me questioning the amount of time that I had spent being in them. Um, so this conversation just flew by for me. There's a lot of information she shares. Obviously, her being a nurse, we discuss a lot about vaccines, and we do get a little political here. But all good stuff, all information, at least I think it's all good stuff. And it's okay if you don't agree, you know, it's not the end of the world. We're still all human beings, and we all have a voice. We all come from different backgrounds. We all come from um different life experiences, and that's what shapes our point of views and our perspectives and our opinions, and you know So, um, again, I've always been kinda, like, weirded out about the COVID-19 vaccines. If you've been following along since the beginning, that is something that I bring up repeatedly, um, our vaccines and modern medicine, really. I mean, I get the purpose of it. You know what I'm saying? That it's supposed to be like it's meant for good, but I still question it. And in fact, I don't even go to the doctor. I don't even go to the doctors. I rarely take any kind of medication when I'm sick. Um, so have I have trust issues. But again, this conversation was amazing. I really enjoyed it, and I hope you guys do too. And if not, I'm sure if you dislike it bad enough, you'll let me know. Um, but yeah, I mean, you might learn something, possibly something you didn't know, or probably actually. But quick shout out to the sponsor. Flavors of the forest, raw garlic dust. It's Bigfoot's breath, dog, in a bottle of powder. I put this shit on just about everything, all my meat, all my eggs, my scramby eggs. It's really good. It's super potent. So go check them out. Flavorsforest.com. That's where you can get the shit. You can also follow them on Instagram. What the fuck? Instagram at Flavors Forest. Get yourself a bottle. Let them know that I sent you. Nelson and Matt, fantastic dudes, and the product is amazing because it's better, in my opinion, than any garlic powder you're gonna get at the store. Also, my buddy Johnny Nitro, he's got a company, Wild Beauty Whipped Tallow Moisturizer. This shit's good. It doesn't leave you feeling greasy and all that shit. I'm almost out of this shit. This bottle, and this is like I'm scraping at the bottom of this one. I got a couple more though. But it's really good, so check them out at wildbeautyproducts.com. They have a whole bunch of shit like lip balm, chapstick and shit like that. Um, a whole bunch of moisturizers, different kinds, different scents than all that shit. So go check them out. I can guarantee you it'll be worth your time. Um, if any of you out there are experiencing any kind of mental distress here in the United States, please dial 988. That is the mental health crisis hotline. They are equipped to help you dissect and kind of navigate through any kind of mental health issues you may be experiencing. Um, and also, if you're not the one experiencing them, but you have a friend, a foe, or just somebody that needs help, and they need help, and they're not helping themselves, you can also dial 988, and they can give you resources to help said person. So I think that is amazing as well. So, um, with that being said, stay another day because doing something to yourself is only going to transfer the trauma. And I know you don't want to do that. That's not your intent, and that's not what you're trying to do. I know everything might seem hopeless, but the hope is in you, and the less is when you're gone. So, um, out of all the things that God created, He looked out across the universe, and He knew that the earth needed one of you, and you came into existence. So don't ever think that your existence means nothing, because it means something to somebody, and you will leave a hole. I promise you. So let's get through it together, shall we? All right, guys, that is my spiel for today. Please like, follow, share, subscribe, leave a motherfucking rating and a review if you feel like doing so. And if you don't, then I hate you. No, I'm just kidding. That is a joke. Please do not take that to heart because that is not true. Um, but if your podcatcher does not allow you to leave a rating and review, please consider doing so on my website. That is where the weird ones are podcast.com. That is also where you can get merch, hot sauce, coffee, supplements, and read some short stories and stuff that I wrote. Yeah. So that's that. That's the kit and caboodle with that shit. I really hope you guys enjoy this episode. Again, Nurse Nicole was amazing. I really enjoyed conversating with her. So, bang, bang, bang. Where the weird ones go production. What's up, everybody? Welcome to another episode of Where the Weird Ones Are. I have a lovely guest for you today. Her name is Nicole. She is a nurse. I've been seeing a lot of clips of her and a lot of things that she's sharing. Super interesting. A lot of you know by now that I'm more anti-vax than I am anything else. I do question a lot of modern societal things. So these are the kind of topics that I like to talk about. And if you want to listen, cool. If you don't, that's cool too, because I'm here for the conversation. I'm not here for the clicks and views. But anyways, obviously you guys know that already. I've said it 100 times. But anyways, Nicole, if you don't mind, um, letting the two people that listen to this podcast know a little bit
Yeah,
about yourself and what it is that you do, where they can find you.
absolutely. So I'm glad to be here for all two of you that are listening. I met Kevin on Instagram on my account, hold underscore the line CLNC. Um, and it's a business page that I started a few years ago as I came forward as a nurse during the pandemic. I have been a nurse 20 years in the cardiac field, and I have done all kinds of things in healthcare. And I happened to work during the pandemic as a heart transplant nurse, where I watched what happened when the pandemic rolled out, what that looked like for healthcare, what it did to our patients, did to our communities, did to our healthcare system. And then also was a nurse that stood up against the mandates when it came to mass vaccinating, and what that looked like for me and my job, and what trajectory it pushed me to when I saw what happened with those heart transplant patients that were receiving the COVID-19 vaccine, because in order to be a transplant recipient and to stay on the list, you had to be fully vaccinated. And unfortunately, at that time in Florida, that did include the C-19 vaccine. And so at that point, we started to see the patients not do well. Patients were dying. And when I saw that, I started questioning it. I was bringing it to the attention of our doctors. They were brushing it away. They were gaslighting us, saying that we were not seeing anything out of the norm. This was because they were just sick. And then I decided to come forward and show my face. And since then, I have worked on a local and state level to raise awareness on informed consent, bodily autonomy, knowing your rights as a patient, how you can have help if you are in a hospital setting, and essentially working with multiple grassroots organizations across Central Florida, in addition to being a nurse on the Nurses Out Loud podcast to educate the masses and show them what it means to be able to have all sides of the information and not just tell you what I think and what I believe, but guide you so that you have the best resources possible.
Dope, dope.
Hell
I
yeah.
like it. I like it a lot. Because there's so many people that are just saying things just to say it,
Right.
without really like helping guide anybody. So I say a lot of things just to say it. Like, so when this whole thing was going down, I was just like, don't get vaccinated. I was telling everybody, I was like, don't get vaccinated. I was like, this thing is coming way too fast. You don't know what's in it. You don't know what's in
Yeah.
if they tell you, if they ask you if you want it, just say what's in it. They're not going to tell you because they don't know.
Mm-hmm.
And like, it was my whole awakening process was through that. And
Yeah.
my girlfriend at the time, my ex-girlfriend, she was very like, well, her sister was anti-vax anyway, so she
Oh,
knew a lot of information about that. So got the none of us in the house, none of the kids or anything got vaccinated. But she was like, she was a masker and stuff like that, and she would wipe down she would wipe down all of our groceries when we got them home. I was like, we've already had our hands all over this shit. So, I'm like, what are you doing? So,
It's
like,
true.
but I mean, I mean, people were scared, so I get,
They were.
I understand. One of the things that I hated about that whole time was I blew a tire on my car, and I went all the way down to Walmart because it was the quickest way to get a new tire. So I jacked up the car, took the tire off, walked all the way down to Walmart, and stood in line because this was when you had to stand in line to get into
Hmm.
all these superstores. Um, and so I stood in line. I have a freaking tire with the rim in my hand, and I get to the door, and then the guy staring at me, and he goes, "All right, go ahead." And I walk in. I walk all the way to the back, and the frickin' tire store is closed for COVID completely, not opening at all. And it had a sign there, and I was like, "This motherfucker watched me walk through this door with this fucking tire, stand in line with this tire, and then just was like, 'Go ahead.'"
So critical thinking has left the chat, especially during the pandemic, right? That is one of the
Yeah.
things that I personally noticed straight out the gate. I've been a nurse at that time. It was 17 years. I mean, like I've worked through swine flu, Ebola. Like I have seen some shit.
Mm-hmm.
And so then this pandemic's rolling out and I'm hearing all these things and I'm like, you're literally going against everything we're taught in science. Like you're allowed to question the science. Literally, we talk about it, we debate, we can question things, we can involve different opinions and not be crucified. And I started to see that you couldn't do any of that. And a lot of the things that were being said were, this is all or nothing. And I'm like, this just doesn't make sense. And then seeing these protocols roll out and what they were doing to the patients. I mean, we saw firsthand that these patients were being told, do not come if you cannot breathe. And who says that to a patient? And then by the time they came to us, they were so far sick that there was literally almost nothing we could do. And then it's just like you get them in there, you put them on a ventilator, you flip them on their stomach, and then you do them off with remdesivir. And so we started to see all these things happen. And again, critical thinking just wasn't there. You would ask people, why are you doing that? And they couldn't answer it. Again, why are you wiping down the groceries when you touched it, the cashier touched it, the little fucking glass window that's like 2 feet away, and then you're not around it? And I'm like, make it make sense. The 6 foot rule, which with Anthony Fauci came out and said that he basically just made that shit up. There's some truth to it because 6 foot droplet, when you sneeze, the idea is that it can transfer up to 6 feet. So there was some truth to it, but the way he portrayed it was not truthful. And so you have all these people just lacking critical thinking. And I don't fault people because you made the very good point of fear. And when you want to control the masses, what do? You make them as fearful as possible. And you then double down and use coercion. And one of the things that I just remember going through, because I joke about a lot of these things, but full transparency, I have a lot of trauma, a lot of PTSD from it because of what I saw and what happened to me as a nurse, that I look back and I understand why it happened, but I could see one thing and then the media and everything was saying another. And it was almost like this weird parallel of like, what reality am I in? I'm working face to face with COVID patients. I am seeing what's happening, but it's not what is being portrayed on the media. And so it was really heartbreaking to see how many people just, they were fearful. And so they just did whatever they were told, never questioned it. And again, critical thinking was gone.
Yeah, yeah. Do what the king says, you
Yeah.
know,
Yeah.
and then let's march for no kings when they're,
Yeah.
I don't know.
See how
um,
well that worked.
yeah. I don't have a problem with that side. It's just I mean, there's stupid people on both sides, in my
Absolutely.
opinion. Um, sometimes I'm retarded. I'll fully admit that. 100%. I do dumb things all the time. I say dumb
Zero
things.
judgment. Zero
So,
judgment. Well,
but
no, I mean, yeah, both sides are not, I mean, and I think that's what is really bold of you, because there's a lot of people that are ride or die for
For sure.
their party. And I'm not saying don't have strong faith in what you believe in, but also know that when people are doing something wrong, you call it out. And I used to be very like in the middle, neutral, and then I just went full blown conservative, like 2A, like all the things. But even on our side, I'm like, yeah, it's bullshit. Like some of these things you guys are doing, you're clowns, okay? And I am a Floridian, and I had a lot of faith in Governor Ron DeSantis, and he has done amazing things, but he's also really turned his back on the medical community. And when that happens, I had to call it out. And so a lot of people were like, okay, what's happening? Like, why are you doing this? And I'm like, because wrong is wrong. And you have to call that out. And it doesn't matter what side it is, we have to hold them accountable. And that's part of what I do, is work with these organizations to call it out and hold them accountable.
Yeah, yeah. I was definitely like the same. I was more like in the middle too, and then the more things. So like again, 2020 and all that shit just kind of opened my eyes, and I
Yeah.
started actually looking into stuff. And you know, I voted for Obama back in the day. That seemed like the right thing to do at the time. He was very articulate. Like
Of
he's
course.
very educated,
Mm-hmm.
and he seems like a great guy. Conspiracy wise, there's a lot of things that I've found out about him that, I mean, not even conspiracy wise, there's actually real things too. So I didn't vote for him the second time. I didn't vote at all because I didn't like freaking Mitt Romney either.
Right. Right.
But
Right.
um, but I voted for Trump in 2016. I voted for him in 2020, and I voted for him again this year, and that has got me myself a lot of hate. And I question him too. I know that he's not perfect. I didn't
Right.
vote for him because I like him. I voted
Right.
for him because he seemed to be the better of the two,
Of course.
all three times.
Yes.
And and a lot of people like they accuse, like, because Trump has really kind of started the lockdowns. He was,
He
you know what
started
I
warp
mean?
speed. Yeah. Warp
Yeah,
speed.
yeah. So he started all that, and then Joe Biden just kept it going and kind of like, I don't know if he made it worse. I can't remember exactly what he did right when he got in, but I know I know he bombed
Mm.
Yemen. I know he
Yeah.
bombed, or not Yemen. He bombed Saudi Arabia as soon as
Arabia.
he got into office. It's this the weirdest thing with these people, and I know this is way off topic about, because I want to talk to you about medical stuff, but um, the weird thing that I find about each president is that they get into office, they bomb a country in the Middle East, and they activate ICE. All of them, no matter what side they're on. They
Mm-hmm.
all bomb a country in the Middle East, and then they and then they activate ICE. At this point, ICE has deported a lot of people. Under Obama administration, it was way more. They
Correct.
deported way more.
Correct.
Um, and so like when I look at this, it's just there's a lot of hypocrisy everywhere.
Mm-hmm.
And I've
Amen.
always I've always questioned modern medicine. And it's I know that the whole point of it is to be good for us, right? But I don't want to take something just because the doctor says to take it.
Correct.
You know what I
Right.
mean? Like, I want more information. I want to
Absolutely.
know exactly like what's in it, with side effects and stuff. I don't want to just be like, oh, like, I don't know, my back hurts. Well, take this and you'll
Right.
feel better. But why? Like, what
Exactly.
does it do to make me feel better? Why does it do that? Um, and I'm sure you can let the listeners know for sure that I'm not just like blowing smoke up their ass, but doctors are incentivized for vaccines.
Yes.
They don't, so they're not paid to put out vaccines. They're paid for the percentage of um, patients that are vaccinated.
Correct. That
So
is correct.
that's why they push it.
Yes. So yeah, you said a lot of great information in there, and to pick it apart, the pediatricians, because that is typically who is given the doses and follow a schedule. Most people don't realize that there's a childhood schedule and there's also an adult schedule. And the childhood schedule current to date, per the CDC recommendations from birth to 18, will imply that you should have close to 72 plus vaccines if you follow exactly the schedule. As an adult, so from birth to end of life, you will have, if you follow the schedule, well over 100, 120. And so it's really unfortunate that we portray health in an injection. And like you said, when you are not feeling right and you go to your doctor and you're saying that you want to know why, what you're asking for and what you have a right to receive is informed consent. So you're just asking for informed consent. You want to know why you're taking something. There's a lot of people, especially in our older generation and some of our newer generations, that when a physician says something, they're just going to go with it. They don't want to question it. We call it kind of following the herd. And it's really concerning that anybody in the medical profession who, yes, took an oath to do no harm, no one would think that they would want to hurt you. And I will say that majority of the physicians, they're just not taught. So it's not malintent. But what happens is, in this case with the physicians that have the vaccines, there is a percentage that they must meet in order to receive the reimbursement out. And we're talking a lot of money, thousands and thousands and thousands of dollars, depending on how many children you have in your practice. And if you meet that certain quota, you will be paid out heavily. And so with that being said, there is a skewed interpretation, if you will, where it's being touted as, oh, this is for public health, this is to make you healthy. But what exactly in these injections are there even, like what's in them? Most people can't even tell you. And what actually are they going to do once you get them? And a lot of parents are not told this, and they will tell you, I was just told that it was required. Required is not mandatory, and most states have some sort of exemptions. And so what's really unfortunate is that parents are told, okay, you're here for your visit, and so we're going to go ahead and give the injections. And then the parents just go with it because they think that's what they're supposed to. And the pediatricians are a little sinister in the fact that they don't tell them that it is an option. You do have a right, and you don't necessarily have to have them if you don't want to. And where I personally was vaccinated as a child, I have two boys. They are vaccinated up until a certain age. Since the pandemic, they will never be vaccinated again. I have not taken certain vaccines for over a decade. I exempt. That is our right to do so. The government at the time made it so that we were seen as subhuman, and they wanted to make sure that our life was, very difficult if you were not compliant. And so to me, that's very totalitarian. But people will say, oh, it's in the name of public health. Well, that's bullshit. If you really cared about public health, you would talk about sunlight and eating properly and hydration, and you would make food more accessible that's healthy, and you would, make environments less stressful, and you would put things in place to help people want to live a healthier lifestyle. But you don't. You give them pills, you inject them with Ozempic to tell them to lose weight, you give them trash fast foods, and then you tote it like, oh, the only way you're going to be healthy if you get a vaccine. And I have never seen so many people harmed than I did during the pandemic and beyond. And now when I represent individuals and we work alongside them, we're talking from infants to adulthood, people that have had serious injuries from vaccines that I could not have ever fathomed because it just wasn't in my sight. I wasn't seeing it like that. And most people think it's a really big reaction. They have all these crazy triggers, and some of it can be gut issues, skin issues, asthma, allergies. Like, it's not crazy, like in your face. And so they never even know that they're actually vaccine injured. So yeah, it's really unfortunate that these pediatricians could do a better job. And what makes it even worse in the state of Florida and in other states, they are allowed to refuse to care for you by law, if they choose not to. If you are not wanting to vaccinate and they know that they'll lose money, they have a right to refuse service to you. And I think that's so unethical and something that we definitely need to address in the future as well.
Yeah. I saw a skit one time not too long ago, maybe like a month or two ago, where this person got into a car accident
Mm.
and they were all messed up. And they come through the emergency room and stuff, and they're like in the middle of starting to the life-saving process, and there I go. One of the nurses stops and looks at the chart and goes, "He doesn't have insurance." And they're like, "Oh," and they all just stop and like walk away from him and stuff. And like it was a skit, but informative
Right.
because it's like you're doing a service to, like, the whole point of being a doctor or being in the medical field is to help people, like,
Right.
and then somebody's literally dying and you're not going to save them because you're not going to get money for it. You know what I mean? It's interesting. I don't know if there's any real accounts of that, but COVID
Yeah.
kind of like opened my eyes to that too. Where they would, I was hearing that hospitals were getting money for a certain amount of COVID deaths. And
Correct.
so my dad's cousin passed away during COVID in 2020, maybe early 21. And it was from a heart attack or something like that. He wasn't even sick. And they called it a COVID death. And he was like, "What the fuck is this?" And my dad is very he's a part of the Matrix 100%. He's totally in there.
I love it.
He might be a little more liberal than he likes to admit, which is
Well,
fine. But he definitely falls for a lot of things. He's in the generation X, where, everything was new. He got all of his information from the news. So he wakes up first thing in the morning, it's news. When he gets home, while he's cooking dinner, it's the news, and so
yeah.
it's
Well,
interesting. But that was one of the moments I was like, "I'm telling you, Dad, there's something fucking fishy going on here." And he's like, "I know," but he
well,
still got vaccinated.
you know how they tell you that it's like a social experiment, right? If you
Hmm.
turn on the news and you hear something, and then you go in the car and you turn on the radio and you hear something, and
Yep.
then you go somewhere else and you hear, eventually you start to believe it. And so this is what happens, right? There's certain entities, organizations, BlackRock, who owns all of the media and everything else. I mean, that's not a conspiracy theory. That's out in the open. They manipulate what you're going to hear, who you're going to hear, and how you're going to hear it and how often. And so it's a form of brainwashing, coercion. I mean, absolutely, without a doubt. And, those patients that went into the hospital, yes, you're 100% correct. The hospitals during the time, because the government had such incredible payouts for this mass operation, they were paying a significant amount of money to the hospitals for every single coded COVID death, whether you had it or not, which is completely fraud, and also would put it on the death certificates of patients who did not die from COVID, but with COVID. So let me rephrase that. I hope that makes sense. They did not die of COVID. They died with COVID, which is totally different, meaning it's not the cause of death. You just happen to have it at the time.
Yep.
And a lot of people were being labeled as that. And so again, for your dad, he's like a lot of others who they trust what they're hearing is being told to them as truthful. And so then they follow and tend to not always ask questions because they're so blinded by fear. And then, again, a lot of these people have lost a lot of things because they were injured, or the other way around, right? They didn't do it
Hmm.
and they lost jobs, they lost pensions, they lost all kinds of stuff. Marriages fell apart. One of the things people don't really talk about was during the pandemic, when everything was shut down, people were not working. Uh, Husband and wives were in homes under stressful situations. Abuse and neglect were rampant. Children who often maybe got their only meal by going to school when schools were shut down are now in the home with no money, no food, no nothing, also being subjected to abuse and neglect because the parent is not working. They don't know what to do. We had a high instance of suicide attempts, people that were drinking, they did drugs, like they couldn't cope. And so there's all these other like nefarious things that happen that nobody talks about. That was also going along with COVID and people getting sick. So yeah, it's really, and then you turn on the radio or you turn on the news and it's like death, doom, gloom, CNN, the death toll, all this stuff. And I'm walking into my patients' rooms and they're watching it. And I'm like, why are we watching this trash. And they're like, oh, well, you know, they say the death toll's over 1 million and everything else, which we now find out was false, inflated numbers. People that had been swabbed, you know, numerous times, and the hospital and nurses were part of that because we were just re-swabbing like we were told. And, you know, all these things were just completely not done in the appropriate manner, and the numbers were inflated. And that is what was fed to people like your dad, who was relying on the news and to hear what was going on. And it's just really unfortunate because even to this day, there's still so many that just believe that's what happened. And, you know, it didn't. Like, it just, there's some of these things did not happen. And getting other people to see it when they weren't a part of it is, I mean, I don't know if we'll ever get there.
Yeah. Yeah. Yeah, no, I agree. There's still so many people that I come across in my daily life that still believe everything that they were told. Um, you know, I think it was I had started a new job in 2013, and a part of getting this new job I had to go do a physical. So when I went and did the physical, they're like, flu shot? And I was like, yeah, sure. So they put the flu shot in and stuff, and then my arm hurt for like a week.
Mm-hmm.
And probably like within that week too, I got really sick.
Mm-hmm.
And I'm just like, why the fuck? And you know, and I was like, every time I get the flu shot, I still get sick. What is the point of getting this fucking shot if I'm gonna get sick anyway?
Mm-hmm.
So 2013 was the last year that I have ever had any vaccinations.
Good for
Um,
you. Good for
and
you.
then I haven't been sick. I mean,
We'll say,
I mean, obviously cold and stuff like that. I do
and
get
you're
sick.
alive.
Yeah, and I'm alive.
Imagine that shit, man. That's what they say.
Remember
They're
Yeah, I remember in 21, my boss was talking about, you know, they'll give us pay we can go get the COVID vaccine and on the clock and stuff like this. And I was just like, are you I like fucking because we had this meeting. I stepped back and I'm like, are you saying that we have to go get vaccinated? And he goes, no, but you should. And I was like, oh, all right. All right. I went
right.
like this. I was like, because I'm not going to
Woo!
get it. And then frickin' the sales guy, we'll be the ones laughing when you're dead. And I was like, oh, that's nice of you.
So, question, if they would have said to you it was mandatory, what would you have done?
I would have left right
You
there.
think you would have left? You wouldn't have
I'm 100%.
100%. Good for you.
100. I was ready right there when
Right?
I asked the question. Because I was gonna tell him if he was like, yes, it's
Right.
required. I would have been like, I'm out of here then. And
Yeah.
I was not to toot my own horn, but I was the best fucking guy he had there. Everybody else was like trash and shit.
Yeah. Well, what state are you in? Are you in Florida? I don't remember.
No, I'm in Maine.
Maine. Oh,
Yeah.
Maine. We should have started with that. Damn, that's a rough state.
Yeah.
Okay.
Yeah.
Wow. Good for you,
Under.
man.
I mean, Janet Mills hasn't made
Woo!
any of this very easy.
No. But look at
So.
you, thriving, unvaxxed. Hell yeah.
Also, the lockdowns and stuff weren't really lockdowns, at least not for me. I worked through the whole thing,
Well, same. Yeah. No, I
you
had
know,
no, there was no
and
break for us.
yeah, and then I'd go home and we would go outside. We'd go for runs, all of us, the kids, my ex-girlfriend, everybody.
Mm-hmm.
Um, and we'd go for runs, we'd go to the parks, we'd go to lakes and stuff. And we'd go
Okay.
to Home Depot and get stuff to do at the house and stuff. And
Okay.
I remember she posted on her Facebook one time that we had gotten seeds and stuff, and somebody was like, "Where'd you get those?" And
Yeah.
she's like, "Home Depot."
Yeah.
And she thought she was like genuinely asking, so she was like, "Oh, we got them at Home Depot. They're in this aisle, blah 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 blah." And she's like, "This isn't a staycation. Those people are at work because they have to be. They shouldn't be subjected to people when this fucking shit is running rampant." And I was like, oh my God.
Literally. And so that's actually good to know because I knew that Maine was one of the states that really doubled down on a lot of their vaccine policies. And as a matter of fact, I don't know if
Yeah.
you know or you've heard, isn't Maine one of the states that's trying to form their own vaccine coalition with, I think, like 10 other states? So when the CDC and RFK Jr. came out and said, like, we're not going to mandate the COVID-19 vaccine anymore, like we're going to drop the flu vaccine, basically just making it personal choice, which is what I believe in. Even though
Yeah.
I would never take it, I'm not going to tell you not to take it. I'm going to give you the information to make your best decision.
Right.
But your state, I believe, is one of them that is trying to get into the coalition with other states to say, no, we don't care what the CDC is saying or RFK Jr. We want to actually push this and make it so that it's not an option. And so I don't know if you were aware. That's
yeah. It's Maine, Massachusetts,
New
New York,
York.
California.
Yep.
Um,
There's actually surprisingly a lot more states than I thought.
yeah,
But I think there's like 10, 12.
Yeah, well, Maine's gone against everything that the Trump administration is doing. So we actually just recently, there our governor is trying to push back against Trump about trans and women's sports right now, and that's her big thing at this moment.
Interesting.
And it's funny because she's running for Congress now. She wants to go to Congress. It's weird once they hit like 80 years old, they're like, I want a seat in DC. But so she's running right now, and one of her things was like, I fight against Trump, and a lot of people in the comments was like, can you run on anything other than Trump? Like, do you have anything else to say other than
Right.
Trump?
Good.
But so anyway, we had there was a school board meeting, and a couple parents undressed in front of everybody and be like, this
Oh, I
is what
saw that.
yeah, they're
That
like,
was
this is
Maine?
yeah, that was
Ooh,
Maine.
I didn't
They're
know.
like, frickin', this is what you're subjecting our girls to. So
Absolutely. I mean, like, I don't ever say to be unkind to someone, but I'm sorry. There's only two genders. It's a male and a female. In healthcare, that fucking matters. It does matter if you're a male or female, depending on how we treat you when it comes to certain medications, surgeries. Like, we have to know that there's different things that could be there. And that's not to be unkind, but also, why do you keep trying to change everything about a woman? Like, I'm sorry, when I pregnant people, chest feeder, bonus hole, don't get the fuck out of here. Absolutely not.
I've never
No.
heard the bonus whole thing.
Oh,
Holy fuck.
yeah. So and there's even more. And I'm thinking to myself, anyone else calls you a cis female, a cis male, I'm like, where are the alphabet community? Why do we keep adding all these acronyms and weird things? And, again, if I don't buy into it, that makes me a transphobe. Or no, I'm not. I'm just talking about legitimate science and what actually matters. And obviously, my religious faith only suggests two genders. And, again, so I'm not saying that people should be treated badly because they make a different choice, but stop trying to erase women. I don't understand why we can't be in spaces and feel safe. I mean, I am a huge 2A supporter. I carry everywhere I go. I train. I don't play that game, and I'm in the free state of Florida. I can't fathom seeing some of these states, how they don't protect women and how men don't stand up when things happen. Like that poor girl who got stabbed on the subway and not a single human being around her stood up, helped her anything until after she bled out, was on the floor. And I just think to myself, it's becoming like a discrimination. If you're a woman, you're not safe and you're not welcomed. I don't know. I just find it weird that she's going to die on that hill to make it all about sports and mingling. We can coexist in our separate spaces.
Yeah. There was a lot of people that suggested just making transports, and I was like, I mean, there's literally not enough. There's not enough trans
Right.
people for that
I
anyway.
guess. Yeah.
I guess it's a very small percentage, but I mean, again, like I would never like say anything to do anything to hurt them. Like they
Right.
obviously they have
Of
a right to
course.
life
Right.
and all that.
Absolutely.
And
Um,
it's their lifestyle. That's what it's
correct.
their life. They do what they want.
Correct.
God gave us free will, so that's
Yes.
what they are choosing to do with it. But I also don't think that and I understand that not all like men transitioning to females are doing it so they can get their jollies off
Of
in the
course.
women's locker room. I know that.
Right. I
But
agree.
there's there's some guys that are fucking
Right.
weird like that. And so that's what we're trying to say. We're not like a lot of us aren't saying that it encompasses all of them. And that's the
Right.
thing that the left likes to do is they like to take a quote from somebody and make it seem like they're generalizing,
Correct.
just like they did with Charlie Kirk and his
Yes.
the black women thing, taking jobs from trying I can't exactly remember what he said, but he was talking about Joy Reid and some other lady, and he said, "If I were to say," this is how he started it. He's like, "If I were to say this," so they just take that little middle clip, and I'm like, and people are
Mm-hmm.
sharing it, and all of them, I was like, "You're missing words out of this quote. There's a lot of
Heartbreaking.
words missing out of this quote."
I
So,
know. It's heartbreaking. The poor man literally can't even defend himself anymore, and people are manipulating clips for likes and views and posting all this
mm,
stuff to try to manipulate the narrative. And, again, it's like you as a human being have the right to talk. We have the First Amendment right in the United States. We should have the right to free speech. It's constantly trampled on. It's constantly threatened depending on who you are. Some groups have more free reign to do things than others. And it's sad because it should be neutral. And sometimes free speech is difficult to hear. You may not like it, but as long as you're not inflaming the situation or harming someone, physically inciting harm, that is part of it. And so, like you said, being able to coexist in spaces, they're human beings. But there is a time and a place for certain things to be separate. And we don't ever want to necessarily generalize because that can get you in a lot of trouble. But unfortunately, in order to make it make sense, there is sometimes has to be clearly defined, definitions of what should be and what shouldn't be. And so, I'm curious how she will turn out running for Congress, what that's going to look like, because you're going to have a little bit more meat in it than just complaining about Trump and everything else. And, I voted for him too, all 3 times. And I go over policy, not personality. I think the
yes.
policies and
Mhm.
getting us where we needed to be as a country is where I voted. He's a typical loudmouth, northerner, in my opinion. And I have family,
He's
they're from New
kind
York.
Yeah. He's
I
kind of
get
a
it.
douchebag. He's kind of a douchebag, you
I
know?
mean, but you know what though? What you see is what you get. And I
Yeah.
appreciate that, right? I don't mind it. Now, I don't agree with everything. There's a lot of stuff that he does. I'm like, what the hell? And that's what I'm saying. We call it out. But overall, if we would not have won this election with Trump, I wholeheartedly believe we would be unrecognizable as a nation going the direction that we were under Biden, and where a lot of people will criticize Trump for Operation Warp Speed. Most definitely.
Mhm.
He never mandated it. And that is where I draw the line in the sand. He didn't force it on us. And healthcare workers were the last, even out of the military. We were the last ones for people to stand up for because we are essentially guinea pigs in the healthcare system, just like the military. They think that we should just do it because that's what you signed up for. You're in healthcare. You can't be anti science, anti vax, but not realizing that we don't even have the same rights as our patients. And so a lot of times those vaccines are being forced on us. In the state of Florida right now, you can't force COVID-19 because we have a law in place, SB252, but the flu vaccine, they come at us hard and heavy. And there's all kinds of things you have to do to exempt out of it that before the pandemic, I never had to do. So we're working on a lot of those things, even in the great free state of Florida, but we get comments and questions and DMs all the time from people in California and New York. They don't know what to do. They're trying to keep their jobs. They're trying to go to school. What do they do with their kids? Because they don't want to get them injected because they've had either a bad outcome or they saw somebody have a bad outcome. And it's just really sad that the government has so much over these people
Mhm.
that they're not giving them a choice. You always should have a choice. Where there is risk, there must be choice. And that's what we say in a lot of our grassroots organizations when we talk to our congressmen. You cannot mandate things, especially when there's nothing in place to help these people. You force mandated vaccines, and then when these people were hurt and they died, you have no resources in place to help them. And that's where I talk a lot about Cody's law. And so again, that's part of the state legislation that we had hoped And
Yeah, so you just I just saw the video of it today. You had posted it, and I was curious because I was gonna look it up. I'm like, what the fuck is this? So
yeah,
since you're here, I would love for you to
yeah.
share what that's all about.
So just in its, rawness, Cody's Law, it's about Cody Hudson, who is in his 20s. He got the COVID-19 vaccine because a family member who's high up in the vaccine community in the United States said it was safe and effective. He was injured. He was severely injured, blood clots. He's had, strokes. He is a very well documented individual. That proves that the vaccine did it, is where I'm getting at. Cody's Law is a bill that we tried to pass last session that just states that one, vaccine injuries exist. Because right now, a lot of people don't think that vaccine injured is a thing. They think it's made up. It's a conspiracy theory. Correlation doesn't equal causation. That is false.
Because it didn't, if it didn't exist, they wouldn't need uh the uh, the exemption, the suit, the what the frick is the word?
1986 Act. The
Yeah,
1986 Act is
where they're exempt from being
the
sued for
liability.
vaccine injury. Liability, that's the
Correct.
word that I was looking for.
Yes. It's the vaccine manufacturer shield. It's the
Yep.
liability shield that was put into place in 1986. So the companies that make the vaccines that tell you that they're safe and effective, which, by the way, for the listeners, not a single vaccine to date, and you can fact check me, has ever been truly placebo tested. A true placebo is a saline injection. Not a single vaccine on the vaccine schedule has ever had that. So by definition, it has not truly been studied as such. And most of the vaccines only were followed for days to weeks, sometimes months, for long-term data. So we're injecting these children with multiple vaccines that have never been tested together, never had a true placebo. And on top of that, the manufacturers have zero liability if something bad happens. But what most people don't understand is there's something called the V as in Victor, I, C as in Charlie, P as in Paul, VICP. For every vaccine you inject into someone, 30 cents goes into this government funded program, the VICP, which pays out vaccine injuries. Most people are denied, which is why it's a joke, but it exists for specifically vaccine injuries. So if they don't cause harm, why do you have that? Why
Mhm.
are the manufacturers protected? And why do you mandate things when there is no one liable? And so a lot of people during the pandemic that were coerced and got the COVID-19 vaccine and got injured, they were left high and dry and have really bad health issues. And so there's a lot of rage, there's a lot of anger, there's a lot of animosity that they rolled up their sleeve. They did what they were told, and now they're screwed. Now they're sick, they've lost their jobs, they can't work, they're trying to get disability. Can't get disability if you don't have a diagnosis. Can't get a diagnosis if they don't recognize you as vaccine injured. That's where Cody's Law comes in. So it not only identifies that you are vaccine injured, it proposes using Medicare and Medicaid programs to get you on the track of getting actual treatment if you're injured in a timely fashion. But because so many people were not recognized as vaccine injured and were never given the opportunity to be treated for their actual problems, because one, there was fear, two, the doctors don't know what they're doing, and three, people were losing their medical license if you were diagnosing people as vaccine injured. They were
Mhm.
reporting those doctors. So this allows them to receive timely treatment, where all these people who have not received treatment, they're getting sicker and sicker, and now they're not rehabable. There's nothing a lot of these patients can get now that gives them any quality of life. Cody's Law tries to avoid that happening because people don't understand all of the things that happen to these patients we see in the hospital. I mean, we are seeing these people, strokes, heart attacks, sepsis, they can't fight infection, neurological issues. 9 times out of 10, we can prove that they've been vaccinated with the COVID-19 vaccine. And now they push shingles, the flu vaccine, the pneumonia vaccine, RSV, and COVID. And when I tell you there's patients that have had 4 or 5 at the same time, and a week later they come in with a heart attack, hand to God, we can prove that. but the data is not being collected in a fashion and put out there just yet. And so people just think they're okay to do it. So Cody's law covers not just COVID-19, but any vaccine that could be given, because there's children that are being harmed. And SIDS is one of the ones that, for the other bill that I talked about, SB 188, would require mandatory reporting to medical examiners if a child, infant child or young adolescent, had a vaccine within 90 days of their death or an emergency countermeasure. And so this is reporting and tracking to put into a system so that the medical examiner must disclose it. We can't show you the data if we're not collecting it. And right now, they're not collecting it. And so that particular bill would force them to collect it and then see what we can do to prevent, see if SIDS is really what we think it is, which means most children that die from SIDS had a vaccine within 7 days. Usually 48 to 72 hours, they were dead, but up to 7 days, those parents reported the only thing that they had, because they were healthy, was a vaccine. And when you give those babies and you look at that vaccine schedule, some of them receive 2, 4, 6 vaccines at once. And these teeny tiny little bodies that are getting tons of aluminum and mercury and formaldehyde. And we just don't think, we don't know. And so these babies brains are being overwhelmed and they're dying. And so again, no healthy individual just drops dead. And during the pandemic, they made that a thing, right? Oh, it's totally normal. Sudden death, sudden adult death. It's like, yes, people do die, but just dropping dead? No, it's not. So anyways, so Cody's law is to identify the vaccine injured, offer programs within Medicare and Medicaid, and make sure it's done in a timely fashion so they don't get worse.
Nice. I like it.
Yeah.
I like it a lot. They just did the first ever study of vax versus unvaxxed children too recently. And they have like the results of it. And he was at Congress. I don't know. He was at a hearing relaying this information, and he's like, "You want the anti-vaxxers to be shut up now? This is what we got to do." And then the guy, the whatever guy was running the show or whatever was like, "You're not a biologist, are you?" And he's like, "No." He's like, "You're not a this and you're not a that." And he's like, "No, I have to find the facts. I can't rely on titles." That was like my favorite line of that whole fucking meeting. And he's like, and then everybody's like, cheers. It was pretty great. But yeah, autism, the fuck, why am I blanking on this? Asthma.
Right. Allergies, asthma,
and allergies, autoimmune issues and stuff like that are higher percentage in vaccinated children than anti-vaccinated.
400% higher in the vaccinated versus unvaccinated for autoimmune disease. Who you're speaking about is Aaron Siri, who is basically a well-known lawyer who fights these vaccine manufacturers in these cases. He is incredible. If anyone wants to follow him, his name is Aaron Siri. He's on all social media platforms. He's really put his neck out there and is constantly crucified, but he really just looks at the data. He really looks at the facts, and everybody tries to discredit him, just like RFK Jr. They say he's not a doctor. Well, nor is Bill Gates. Bill Gates isn't a doctor with no degree. And, people take advice from him. So I think it's really important people get to know who these people are, what they stand for, and what they're trying to do. And that study can be found at on an unconventionalstudy.com, where you can watch it for free. And it basically talks about the Henry Ford, protocol that was done for the unvaxxed versus vaxxed, that he found out that unvaxxed children were more healthy. And when he found that out, he said, I can't publish this. This will ruin my career. This will ruin others' careers. And instead of doing the right thing with integrity, which I can empathize probably would have been brutal for him, he decided to sweep it under the rug he hit it. And so now the data is out for those to hear and watch and see what it looks like. But, so many children have died. So many adults have died because, we sometimes have to give adults vaccines. And so there could have been a lot of lives saved. So I don't know if I really want to say that I'm, so grateful that he decided to agree to let some of this information out now. He should have done it back then. To me, you have to be able to lay your head down at night. I can't fathom knowing that kind of information and withholding that and knowing how many people are being hurt. But yeah, it's a great interview documentary on inconvenientstudy.com, and you can watch it for free.
Nice. Nice. One of the things that I had learned through during COVID was so I found this book, and it's called Vaccination Horrors, or the Horrors of Vaccines, or something like that. It was written in the 20s, right after the Spanish flu. And this doctor, I can't remember his name, but he took a bunch of volunteers, that had the Spanish flu, people that didn't have the Spanish flu, to see if it was, because Spanish flu is similar to COVID, I guess. I don't know, because I wasn't alive in the 20s, so I don't know exactly. But anyway, so he did this study with like hundreds of people, and he would have, a sick person and a healthy person. The sick person cough into the healthy person's face and do all this stuff that they say transmits the flu, and it was not happening, I guess. So,
There was
and
no transmission.
there was no transmission. And that was really interesting to me.
Well, I do know that I'm not as familiar with that book, and I'm trying to think if I I want to say they're probably going to say that book is not truthful. From what you're saying, I'm wondering if they come out and say that it's like a conspiracy theory. But
They
I do
probably
know.
took it down already, to be honest with you. You
Well,
probably can't
but
find it.
during the Spanish flu, like, again, we always have to think about some of the things that they would do, right? Like, what was the sanitation like? A lot of people will say, oh, well, vaccines are so necessary. You don't understand. And I'm like, yeah, maybe in a third world country, but when you have running water and the ability to wash your hands and, have proper sanitation, sunlight, access to clean, fresh water, your likelihood of being sick is much lower because you have access to things that help keep you healthy. And so, but I'm not saying in other countries that may not be the case, because yeah, there's different situations, but that particular time frame, not only that, they realized that when they were masking, that it was basically causing more problems. And why today,
Yep.
when the whole pandemic happened and they keep harping on masking, like, oh, if you mask, you're this, that. If you take someone's sleeve off their shirt, which is what was happening, people are walking away with sleeves, they're wearing masks for like 4 or 5 days. There's like boogers, there's snot, there's spit, there's whatever's in their mask.
Wet.
That's right. Ew. Like, that is not keeping you healthy. That is literally keeping the bacteria on you. Like, we had people that had skin infections, mouth infections, because you had a dirty mask. People need to know that the size of the virus mute when you wear a regular mask. And so that's why it was just silly. It made no sense. And honestly, added to the problems when it comes to children being delayed because they couldn't read faces. They're at these critical ages where they try to learn words and how to talk. That's why a lot of our children during the COVID pandemic now that are in kindergarten, first grade, they're behind. Their speech is behind, how they interact is behind because they were locked down in so many states. And then, of course, working in the hospital, I worked with elderly patients. I mean, I'd hang my mask because I wasn't compliant, so they wanted me to wear a mask. I'd wear my mask hanging off my ear because I have these little old patients that are like, what? Where do you, like, they couldn't read my lips, wearing a mask, they're impaired. So I'm like, the hell with this. I'm not doing this. And so people just tend to forget human interaction to isolate someone cruel, one, and two, literally killed people. When you isolate people to the point of no human interaction, like not touching them, not letting them see your face, hear your voice, all of these things, and wearing these stupid masks, it literally made things 10 times worse. It, I think, truly is what drug out the pandemic as long as it did, in addition to injecting
Same.
for shit that was irrelevant. And again, holding people on lockdown. Herd immunity is a thing, okay? And passive immunity is another thing. And so it's just part of it. All of us have had some sort of contact with COVID, whether it's the vaccine, whether it's the virus. Not a single person on this earth has not been touched by that. It is what it is. And so instead of making people live in fear, you teach them how to take care of themselves. And I can't say worth a damn that I've seen any president or anybody yet so far that has gone on there, especially during the pandemic, and was like, okay, so what are we going to do to keep you healthy? Let's talk about important vitamins. Let's talk about sunlight. Let's talk about nutritious food. Let's talk about, I didn't hear anything like that. I hear wear a mask, stay home, stay isolated, and then inject yourself. What is that?
Yep.
Like, that's not
Yep.
science.
Yep. Yep. And one of the things was I was looking for something to use, but I'll just use an imaginary thing was to go get vaccinated. You get one of these. I'm like, I saw one of those and I was like, what the fuck is happening here?
So I heard some states even offered like weed. They offered gift cards. Down here, some companies offered tickets to Disney. Like when I tell you the
Jeez.
bar is in hell, and people like rolled up their sleeves, and I'm like, you're the breadwinner. Like if something happens, yeah. Well, again, the pandemic, the silent pandemic, whatever you want to call it, is the vaccinated, and they're
It is.
sick and hurt and harmed, and people don't believe it. They say we're dramatic, we're crazy, you know what you're talking about. And I'm like, I'm telling you, darkness, light, light will always come out of the darkness, and there's no hiding it. And we will all see the truth and hear it. And these people that are vaccinated, I know some people felt like they had no choice. I'm going to pray for you. And I really hope that you have the resources available to you. But yeah, people need to care more, because until it happens to them or a family member, they're like, has nothing to do with me. And I'm like, oh, it will affect you, whether it's you not being able to get into the healthcare system because we're so backed up with people that are sick, or the loss of jobs, increase in disability. Our taxes are going to go up because all these people can't work. It'll happen at some point.
Yeah, for sure.
Yeah.
My uncle passed away of a heart attack shortly after he got COVID. He got like, it was just one of the boosters that went with it, so he already had a couple already.
Right.
And then all of a sudden he was gone. And he was never sick or anything. He was just like all of a sudden boom. And he was healthy. Wasn't like the face of health,
Right.
but like,
Right.
he was fine. There
Right.
wasn't anything wrong with him, and then for that. So that,
I'm sorry to hear
I
that.
mean, we don't know for sure. But like once I found out that, like, I'm sitting there, I'm literally standing there at his funeral, and I was like, was he vaccinated? And they're like, yeah. Like, I knew it.
Well,
Unfortunately, but I mean, it's because he passed in 21 or 22.
God
No, it was
bless.
22.
And a lot of people weren't able to do the autopsies. And there were some people that did, and some people
Mm-hmm.
knew better to get the tissues tested. And that's when they started finding out in the autopsies of those who had passed, who were vaccinated, that the spike protein did not stay in the inoculation site. It started to spread throughout their body. And that's how they found in those autopsies where those spike proteins were going. And we're talking, it crosses over into the reproductive organs, blood brain barrier, all major organs. And this is where it was going when we were all told in the healthcare sector that once you're injected, it just stays where you injected it. False all day. And so some people did have the money and the means to get those autopsies into their family and can prove that the spike protein was all over. And we did see a higher death in males especially related to cardiac issues. And obviously, being a cardiac nurse and in the job that I'm in now, I run an entire program with multiple hospitals for everyone that comes in with chest pain or a heart attack. And I will say, without a doubt, 95% plus of the ones that come through my program have anywhere from 2 to 10 COVID-19 vaccines. They're all the ones that are having heart attacks or NSTEMIs or because we remember in Florida we have a lot of snowbirds. So they're coming down from states that I have some patients that got 5 in 2021 alone. 5 COVID-19 vaccines in 2021.
Gosh.
So we're seeing it. The data is there. It's not being published or thrown out there, and I run the chest pain program. So a lot of these patients are having heart attacks, coronary spasms, chest pain, NSTEMIs, or cardiomyopathy issues, and requiring a pacemaker or an AICD because it destroyed their heart muscle. My counterparts do stroke. The amount of strokes that have tenfold in the past few years. And then the other thing that I talk about a lot that I started to notice, besides not being able to fight infection, a lot of these people are always sick, like always sick. They can't fight shit. And the other thing is cancer. I spoke about this on a podcast, many years ago. And I remember as a travel nurse, I would go and they would float me to the oncology floor. Oncology is not my thing. I'm a heart nurse through and through. And I remember going there and I'm like, these people are young and they're like really far advanced, right? And I remember talking about in the Children's Health Defense Vaxxed Bus, because I'm in the Vax 3 documentary, just a little bit. And I remember saying, I had no clue why all these people were so sick and had cancer and they were so young. And then I started connecting the dots and I'm like, there's no way, because this is before we knew. This is before it was talked about. There's no way these shots are causing cancer. That's freaking wild, right? Like, could you imagine? Bro, not too long after that, they proved that batches around the world were tested and there were hot lots and there was vaccines, COVID-19 vaccines that had SV40 in them, which is a contaminant that causes cancer. On my life, I remember and that is why we're seeing a rise in cancer. People are saying it's not true. They're saying there's no way. And I'm like, dude, we're talking like young people. And we're not saying just getting cancer. You're getting cancer and then you're dying within less than a year, like rapid turbo cancer. I'm like, who makes that term up? What does that even mean? I've never in my life. 100% truth. And this is why ivermectin, fenbendazole, and all of these protocols are coming out now, because people are being diagnosed with cancer rapidly and they're not responding to chemo and radiation. So they're trying these other drugs out that have been proven to be used in high doses to help treat cancer. So like we're on a wild, like this COVID-19 shenanigans caused a buttload of problems. And I'm telling you, a lot of people are affected, and people, I just don't think they realize like what is happening and the level and the magnitude. Like if you don't know someone that has been harmed by the vaccine or dead, I would like to speak to you, because it's just unheard of. Like everyone knows someone who has been hurt or no longer with us, and think that it's the vaccine, because otherwise there was no other indicators prior to them getting the vaccine. Wild.
Yeah. Very, very.
Have you ever heard that before? Did you ever know about that? The SV40?
No, I didn't.
You have to.
I did not.
I'll have to send you stuff. Yeah.
Yeah, you should. I mean, because I look into things, but I don't look into things, if that makes sense,
Yeah.
I think a lot of us kind of are like that, where we try to look into things and we find some things, and then there's other things that we don't. But then there's a lot of people that just rely on the news or TikTok videos to get their information. And I will say I learned today that Israel bought TikTok, and they are now
surprise.
banning and deleting anything that has to do with Charlie Kirk or saying shit about Israel. So
Isn't that wild?
It's so fucking crazy.
and against free speech, and then people are going to be called anti-Semite. Like, that's not
Yep.
how this goes. That's not how this
Yep.
goes. Wow,
Yep.
crazy.
Yep. I'm not. I've said it before. I'm not anti-Semitic, but I am anti-government of Israel.
Same. I have friends that are from Israel, so I know sometimes certain things that are said can be very taken to heart.
Yes.
But for
Yep.
anyone listening, I don't care who you are, where you're from, if you're a decent human being, that's what I jive with. But Israel's government, and I will say it, is corrupt, and the United States kisses their ass. And so at this
Absolutely.
point, I don't give a shit. You know, at this point, we know it's wrong and we know what they're doing. And a lot of other people are waking up, especially after Charlie's death, and shame on them. So again, what a time to be alive.
Yeah. I talk about this a few times. One of the episodes that I just put out today, I talk about my coming to Jesus moment. It was kind of like coming anyway, but like right when I saw the video, because I heard about it, I pulled over, and just had to fact check it. I was like, "There's no way
Mm-hmm.
that happened. There's no way." And I literally see this, and I'm
Mm-hmm.
like, I've fucking got chills and this vibration, and now I have a cross around my neck. So, and there's a
Wow.
Bible upstairs. My kids were really what was pushing me first. I'll tell you that. The listeners, they all know this. And you know, I in an episode in that episode that also came out this week too. You know, I do apologize to the listeners for all the political stuff um and stuff like that. I'm sick of politics, and I do talk about Charlie Kirk. So if you guys don't want to listen to it, don't listen to it. And here I am now. I'm talking about it again. Which you know, your minds change sometimes. But anyway, so every like I said, everybody that listens already knows this story, but I'm gonna tell you, it really started with my son about almost 2 years ago. He made a TikTok channel where he was sharing scripture. So he'd take like a picture of a quote from the Bible and stuff, and he'd post it with like music and stuff like that. And we started having conversations about God and Jesus and stuff. And he actually comes on in an episode, one of my later episodes from like a year or two ago, and he literally comes out and says, "Follow Jesus and you'll have love," or something like that. He's just talking about the love and light of Jesus. He's only 16, and last year for Christmas, so me and my daughter sitting here listening to me and my son talk about God and Jesus and the Bible and stuff like this, and she goes, you know, I asked mom um for an iPad for Christmas, but I think I want a Bible instead. And so
Wow.
I was like,
Wow.
what? So now that my son has like several crosses that he wears around his neck, several different ones. He wants to get baptized. My daughter wants to get baptized, and
Good job. Good job.
um, yeah. So, and then when this whole thing happened, it was like I was kind of there anyway. And then when this whole thing happened, I was just like, it's now or never, you know.
Amen.
There's a whole lot of things going on that is where I mean, there's spiritual warfare everywhere all the time.
Yeah, absolutely.
Um, so I think,
Yeah, that's incredible. I mean, what a testimony to have both children so involved in that. I mean, especially in
mhm,
this day and age where there's a lot of anti-God and removal of God. And, you know, I
mhm,
don't judge whoever wants to have faith or not. I'm a Christian. I believe in it. I think there's always a silver lining in stuff that's tragic. The pandemic was absolutely horrific, but it shed light on so many things and woke so many people up. That was the silver lining. Charlie Kirk's death, same thing, right? We watched this horrific, tragic assassination. You know, as a nurse, as soon as I saw the video, I knew he was never coming out of that. He was not going to make that. Um, and then knowing the aftermath, right? Seeing all these people turn to Jesus and, know that there is something after this earthly world. And then seeing the other side, like totally hateful and like wishing him harm and all this other stuff, and kind of the contrast of what that looked like. And just realizing like
Mhm.
we are in a spiritual warfare, and it is really important that we have that faith. And I always go and use the I don't know if your son is familiar with Isaiah 6:8 is the one that I use all the time. And then the voice of the Lord said, "Whom shall I send, and who shall go for us?" And I said, "Send me." And so we use that a lot in a lot of the things that we do, like coming forward and being kind of on that front line to do the right thing, stand in for those, lock arms, and being able to what we call hold the line, right? And it can be really difficult because a lot of people drop out of that and don't want anything to do with it, or they're afraid. And so I always talk about Isaiah 6:8. And so I'm curious if he knows that one, but that's really amazing. And I'm happy for you, because again, it's a big deal. It's a really big deal.
Yes.
I'm glad you were able
It's
to come to the good side.
yeah, yeah. There was a whole lot of thing. I think the other side helped push that too, the way they reacted. There was
Yeah.
somebody that I can't remember if it was a video or if it was just a written post, but said that they hope that his daughter sees the video every day for the rest of her life until she decides to take her own. I was like, what the fuck?
Mhm. You know
She is 5 years old.
how much hate and just self-loathing do you have to have as a human being for that to make sense to
Mm,
want to say out loud? You know what I mean?
yeah.
Like, I think about that. I've not heard that. So that is wild. But I do not underestimate the fact that there is such a level of evil and just satanic, just whatever you want to call it. It's bad. And so there's a lot of people out there, and we have to protect our children, and that's the big thing, right? A lot of the
Absolutely.
things that I do is to protect my children and the children of others and the future of our children. And a huge misconception that people think is I'm vaccine injured, or that I took the vaccine and that's why I'm so passionate. And I am none of those. I have a severely autistic vaccine injured brother. And then I watched slowly people die during the pandemic, and I was screaming from the rooftops. Anyone that would listen, I would just talk. And then finally, I started to show my face. I was getting death threats. I had all
Oh, I
kinds of
bet.
things that go at me because I'm a nurse. And I just
Mhm.
kept thinking to myself, we're not saving enough people. Too many people are dying, and in the worst of ways. And when you're there, because I know we're getting kind of to the end of this, or whatever, when you're in a room and at the time there wasn't allowed visitors, right? And the patients were so sick, and I have seen thousands of deaths. I've been involved in a lot of deaths as a nurse. It's just it is what it is. But when you have to tell someone that they can't see their loved one for the last time, or you have to take an iPad, I'm gonna try not to cry, and that is the last thing that they see, that really fucks you up. So I tell people, I don't care what happens. You can't take anything else from me that hasn't already happened. I will ensure for the rest of my life that I will always stand up for what's right, and I will never comply with the madness, because those people that are no longer with us deserve people to have the balls to say, we're not doing this. Like, fuck you. You can stand down. You can do whatever you got to do, but it ain't going to be with me. And so it's trying to teach people, you have every right. You are not the property of the government, okay? You are your
Mhm.
own person, but you have to stand up and you have to speak out, and you've got to want it, or you will lose the little freedom that you have. And freedom is not free. Fighting for freedom in my world is not on a battlefield. It's not on a battlefield. It's in everyday life and healthcare and everything else that we do. So people just need to realize, like, it's a real thing. They will take, if you give them just a little bit, it's gone. It's gone
Yep.
forever. And people just they don't understand. They still don't
Uh,
understand.
that's why 2A is so important.
Amen. So you're gonna have to pry it
That's
out of
so
my cold
so
dead
important.
hands.
So,
Yeah.
but I did want to say before we get off of here, I literally just talked to my son about Isaiah 6.
Did you? Isaiah 6
Yes,
8? Yeah.
yes, literally like this past weekend, and I asked him if he's heard about it, and he's like, no, and I talk, which is funny because we've watched Fury,
Okay,
which
yes.
is it's
Yes.
an emotional scene.
Very.
Is that verse with
It
Shia LaBeouf? It made me cry.
it did you know about that movie, how it actually changed Shia LaBeouf?
Yes.
He
Yep.
was so deep in that character that it literally messed him up. I could replay that entire scene to the end of my time. It is so impactful and powerful. That movie is incredible.
Yeah, which actually I made an AI song. I wrote the lyrics, but I put it into this AI thing, which I know a lot of people have this like with AI, and it's I think it's helpful, but also if you use it correctly, it'll be helpful.
Right? It could be,
And
yes.
yes, so but anyway, so I wrote a song, and I like when I because it was like the whole like first week as I'm like coming into this, I was like all about God. I was like, I want to listen to music about God and this and that. So I wrote this song, and it's here am I, send me. That's how it starts, and that's what it's all about. So
So you made it?
uh, I wrote it, and I put it into the thing, and AI just made the song about it with my lyrics.
Are we going to hear it? Is it going to debut?
I was gonna play it, and I forgot on one of my previous episodes, but
Okay.
I'll put it out with this episode as the outro music, and then you'll
I'm
be able
totally
to
here
hear
for
it.
it. I love it. I really appreciate you having me on. It was a really good
I appreciate you coming
conversation.
on.
I hope you learned something. I hope your listeners learned something. And again, we're better in large quantities. We're better, together. And so I just really hope that people take something from this and it's beneficial to them.
Yeah, and look it up. As you can look her up and ask her questions if you have questions. And
Absolutely.
you want to talk about this stuff. She was very freaking A. Well, I'm like going like blanking on words tonight,
I,
man.
I'm giving you
Um,
the confusion. He's like, oh, she's freaking me out.
so yeah, I mean, look up everything. Don't take everything at face value. Obviously, don't listen to the
Yes,
news. I mean, obviously you can listen to the news if you want to. That's
absolutely.
totally your choice. But
Just make sure you get all, it's called informed consent. Make sure you get informed
absolutely.
consent and that you're educated and that you have good resources. CNN or just Fox, that's not good resources. You have to go to
Hmm.
reputable sources. Your life depends on it, truthfully.
Absolutely.
Yeah.
Absolutely. Absolutely. One more time, can you tell the good people where they can find you?
Yes. So on Instagram, I spelled it wrong in the chat, but it's hold underscore the line CLNC. And then I actually have Twitter, which is Hennessy
You can spell
03. So
it.
HENNAC 03. I flubbed it. So yeah, so I have that, those two there that I go with. I'll fix it in the chat because I'm like a mess right now. But yeah, and I also am on the Nurses Out Loud podcast. We have 7 nurses on there. We talk about all things related to healthcare, medications, and you can also write questions into us there. We're on America Out Loud News, and we like to just interact and let people know like what's going on and answer questions. So on nursesoutloud.com.
Put all your links in the show notes and all that. And yeah, so everybody will be able to find you. So, all right, guys, that is the show. Please like, follow, share, subscribe, leave a rating and review. If your podcatcher does not allow you to leave a rating and review, please consider doing so on the website where the weird ones are, podcast.com. That's also where you can get merch like this shirt behind me, if you can see it. I don't know if you can. But there's a ton of other designs. Also hot sauce, coffee, and supplements. Also some short stories I've written, if you're interested in reading short stories. But other than that, everybody, you know the drill. Question everything and stay
Amen.
weird.
Whom shall I send, and who will go for us?
I rise out the ashes, fist to the sky.
Here am I, send me!
Dark nights, heavy chains, demons stalk my steps, but I stand unshaken. Spirit in my chest, world full of violence, shadows on the land, but I grip that word tighter than the steel in my hand. I've been broken, I've been bruised, still I walk through the fire. Every scar on my skin, just fuel for the choir. God called out, who gon' stand in the breach? I said, I'm your soldier, Lord, send me to the streets. Here am I, send me. I'll fight where the strong fall weak. Here am I, send me. In the pit, in the dark, where the lost can't see. Here am I, send me. I rise with the cross, chains break, souls free. Here am I, send me. Lord, I'll bleed for the mission if you're with me. This ain't no Sunday suit, this is blood and sweat, boots in the mud, cross carved in my chest. Every prayer is a weapon, every verse is a blade, cutting lies out the system, let the truth invade. I don't run from the darkness, I was born in the fight. Line of Judah in my lungs when I roar at night. The world asks, who gon' stand, who gon' pay that cost? I say, put me in, coach, I'll carry that cross. No fear in my eyes, no quit in my bones. I was made for the storm, I was built for the throne. When the trumpet sounds, let the enemy flee, 'cause the Lord called out and I answer, send me. Here am I, send me. I'll fight where the strong fall weak. Here am I, send me. In the pit, in the dark, where the lost can't see. Here am I, send me. The cross chains break, souls free. Here am I, send me. Lord, I'll bleed for the mission if you're with me. Who shall I send? Here am I, send me.